Hello, everyone. Welcome to the Strategies to Attract and Retain Public Health Talent. I'm Beth Resnick. I'm part of the Consortium for Workforce Research in Public Health. I'm here with a number of my colleagues, and we're going to be talking to you about strategies to attract and retain public health talent. So we have three presentations in this session. One, Come Work With Us, How to Improve the Health Department Job Application Experience by Johns Hopkins Bloomberg School of Public Health Research Team. One, about remote work and how state practices impact rural local public health in particular, by our team from University of Washington. And last but not least, education benefits among governmental public health employees by the Indiana University Fairbanks School of Public Health. So just really quickly, our Consortium for Workforce Research in Public Health is 6 different universities, all listed here, and there are 3 universities represented in this presentation. And just very briefly, CWORPH focuses on the public health workforce, and we are funded by HRSA and CDC, and have done a number of great work that you can see on our website at cworph.com. And we do not have any financial conflicts here, and we are funded by HRSA and also the CDC for all of this work. So really quickly, when we think about the 3 of these presentations holistically about attracting and retaining talent, it's really important to think about this throughout the entire full employee experience. Basically, from the time that a person applies for a position to getting onboarded, and then their experience while they're in the job, all connects to how they will come to public health and, most importantly, stay in public health once they're working there. So these 3 presentations that are going to talk about strategies to help improve those attracting and retaining talent really focus in on the job application and hiring experience right from the get-go. Once you're there, the workforce flexibility and organizational culture, which is really important, especially as we think about younger employees, and the pipeline and how they can continue to advance up through educational benefits and career development opportunities. So with that, I'm going to pass it off to my colleague, Palani Mui from Hopkins, about the job application experience.
Thanks, Beth. So I'm Palani Mui from the Johns Hopkins Bloomberg School of Public Health, and I'm going to start us off by discussing our work on Come Work With Us, How to Improve the Health Department Application Experience. Next slide. So in terms of a brief background on why this work was needed, many state and local public health agencies face ongoing recruitment and retention challenges despite recent increases in applicant numbers. And these challenges are driven by underlying structural barriers, including inefficient hiring processes, as well as uncompetitive pay. So our study aimed to advance public health workforce recruitment by assessing the current state of the health department job application experience and hiring process, and identifying strategies to improve this in state and local health departments. Next slide. So we structured this as a cross-sectional study with 2 main components. Specifically, we conducted qualitative semi-structured interviews with 16 state and local health department employees on the job application and hiring process. And our interviewees represented 4 states and 6 localities across all 4 regions of the US, and included hiring managers and human resources personnel, as well as recent hires, defined as those who were hired and onboarded within the past year. We then conducted a supplemental observational scan of publicly accessible state health department job application portals across all 50 states and DC, in particular looking at the clarity of available job listings as well as the ease of navigation within those portals. And we chose to focus our scan on state agencies to really enhance comparability across sites and limit variability in structure, resources, as well as hiring systems. Our team then conducted qualitative analysis and thematic coding of the interview findings and triangulated these with our observations from the portal scans to identify key themes and also strategies for improvement. So there were 3 key themes that emerged in terms of recruitment and hiring challenges. The first focused on structural factors related to improving the job application experience. The second was focused on market dynamics and the importance of remaining competitive. And the third centered on work culture and the need to balance flexibility with accountability. And we'll walk through each of these in detail in the next few slides. So with regards to our first theme, a key finding we found was that most application portals aren't that user-friendly and often lack a user-centered design focus, which makes navigation challenging, especially when searching and filtering through open positions, as well as the number of click-throughs it can take for someone to actually access a posting. Additionally, job postings vary in terms of how clear and specific they are around expected duties and responsibilities, with a lot of them often skewing more towards a broad generic description that makes it really hard for our applicants to really know what exactly they're expected to do in a particular role. Applicants also receive inconsistent guidance on the application process and hiring timeline. So some might not hear back at all after applying, whereas others might actually receive more regular updates. And postings often also will have limited information on work culture, non-traditional benefits, and professional development opportunities, all of which are things that can influence whether someone decides to apply, as these details are often particularly important, especially to younger workers, as well as those who are looking for more workplace flexibility and growth. So identified strategies to improve these challenges include optimizing application portals to improve navigation, ensuring job applications or job descriptions are tailored to specific roles, and also including details about the hiring process and timeline in the position description itself. So even a basic, you'll hear back from us within the next 2 weeks, and here are the next steps, could help applicants feel more supported throughout the process. Including supplemental application questions can also give applicants another way to showcase any relevant experience or qualifications that might not be obvious from looking at their resume alone. Additionally, providing a candidate profile or hiring contact information wherever possible could also help applicants better understand the role as well as who to reach out to if they have any questions. The second theme was around remaining competitive with other employment opportunities. So health departments often can't match salaries provided by hospitals as well as by the private sector, particularly for clinical positions as well as specialized staff. And public health nursing roles in particular were repeatedly cited as especially difficult to fill, as evident from the top quote on the slide. And at the same time, agencies often operate within rigid pay scales and classification systems with limited ability to negotiate salary, as referenced by the second quote. And this makes it challenging to compete with employers who can move more quickly or offer higher salaries. Interviewees also shared how broader funding and resource limitations can impact salary offers and hiring flexibility. And these can be further impacted in some cases by regional pay parity rules as well as state and local tensions. And lastly, there was emphasis on how remote and hybrid work has transformed recruitment dynamics, with some employees leaving for positions that either offer more flexibility or agencies having to increasingly compete with employers who can recruit nationally for remote roles. In terms of ways to remain competitive, the strategies shared centered around intentional communication with applicants. Because health departments often have limited flexibility on salary, several interviewees actually emphasize the importance of clearly communicating the value of the work as well as the broader benefits of the role. And this includes highlighting the public health mission, the opportunity to contribute to community impact, as evident from the quote on the right, as well as to ensure that job postings clearly describe and highlight non-salary or non-traditional benefits. So things like tuition remission, professional development opportunities, supportive workplace policies, flexible work options, as reflected in the quote on the left from a recent hire. And as a whole, showing applicants the full value of the role beyond just salary can help agencies really better attract and as well as compete for stronger applicants and candidates. The third theme was around balancing flexibility and accountability. And so in the post-COVID era, we've seen a shift in workforce expectations, particularly around younger workers, regarding flexible work options as well as work-life balance. And agencies have had to find ways to remain flexible while also maintaining efficiency and accountability in alignment with whatever policies and practices they already have in place. And finding that balance can be challenging, as noted in both of the quotes on the slide. What position you hold also matters, as in some cases, some positions, for instance, frontline staff, clinical workers, and others might have restrictions on flexible work options. And some strategies to achieve better balance include setting clear expectations around available flexible work and scheduling options early on in the application process, as well as emphasizing available benefits, resources, policies, and supports to advance work-life balance. So applicants know exactly what to expect going in and can come in with a better understanding of what is available to them. Next slide. In terms of limitations, this was a cross-sectional study, which is important to note given the changing labor market as well as the shifting public health landscape over the past year. Additionally, based on who was available to participate, our sample did end up including primarily decentralized departments, which means findings might be less applicable to centralized agencies where the state has greater oversight of hiring. And finally, due to variation in state and local contexts, governance, and resources, our findings might not be generalizable, although we do think the majority are still relevant to most departments. A few final takeaways from this work. We want to emphasize that improving the job application experience is a department-controlled lever that can be used to strengthen the recruitment, even in the face of a changing labor market as well as structural or budgetary constraints. And as a whole, the identified recruitment challenges reflect both technical barriers. These are the systems or policies that make hiring difficult, so things like slow approvals, rigid classifications, and portal design, as well as adaptive tensions, which are the cultural and organizational issues that will require changes in leadership and workplace practices. So things like workplace flexibility, accountability, and having an organizational culture with transparent communication about benefits and opportunities. In the same vein, while compensation structures may be constrained, departments can control how they're communicating with applicants, as well as how transparent and clear they are being throughout the hiring process. And in general, improving application communications, so inclusive of emphasizing mission, describing the job responsibilities as well as flexible work options, and providing regular updates throughout the hiring process can really make a big difference in terms of creating a culture where people feel wanted and valued from the get-go when first applying for a position, which in turn can then improve competitiveness as well as advance recruitment and retention. That's all from us. If you have any questions, please feel free to reach out to me or Beth, and I will now turn it over to Betty to present on her work next.
Great, thanks, Palani. And I think y'all will see that the presentation I'm about to do takes a deeper dive into much of what Palani was talking about in terms of flexible schedules, etc. So I think if we were seeing you all in an audience, I'd be asking you if your organization has a remote work policy and what that might look like if you have one. And then my guess is that there's a lot of that going on these days. And since many workplaces today outside of public health, nationally inclusive of public health, it's happening more and more across the US. Recent study in 2024 found that almost a quarter of US workplaces of the workforce is reporting that they're working remotely some of the time, almost a quarter. And this is increasingly common among our own public health agencies. And of course, to do it is in part to increase the pool of potential candidates for positions. And that might include people who are working somewhere else in health departments elsewhere. And we could see from Palani's presentation that that's an important strategy. When this occurs among state health departments, when they create remote work policies, fully or hybrid or partially remote work policies, that could have a potential to particularly challenge or maybe benefit rural local health jurisdictions. Agencies that have particularly difficult time filling positions, but that could also benefit from state health department staff who are well versed in meeting and supporting rural public health needs, because maybe that's where they came from. But little is known about how remote work it's a relatively new implementation in many health departments, but we don't know really how it's impacting rural local health jurisdictions. So our study came from concerns we were hearing about from among our rural public health practice partners. And thus we sought to more deeply explore public health perspectives on remote work among rural local health department leaders and how these remote work practices among state health departments may be affecting their efforts at the local level. So to do this, we conducted qualitative interviews with rural local health department leaders from states where it was understood that the state health department had some policies supporting various forms of remote work. And we used thematic analysis to refine and describe our themes. And to be clear, this study only includes qualitative perspectives from those in local health department settings. So our findings are from that lens. We also did some quantitative analysis with the 2024 PHWINS Public Health Workforce Interests and Needs Survey data. And we use those national data on state and local health department staff to descriptively look at differences in job satisfaction and risk of turnover among staff that are working remotely versus non-remote. And so I'll talk a little bit about that, but today I'm mostly talking about our qualitative findings. So in our sample, our qualitative sample, about 2/3 of the sample identified as female, with most of them over 40 years of age. All of them identified as white, and all had a fair amount of experience in public health and in rural public health specifically. Now, this blue chart on the left describes the distribution of remote policies that all the interview participants had at their local health department. So as you look at this blue chart, you'll see none of the local health department people we talked to had a fully remote option for staff, but half of them had a hybrid policy, like 1 day a week or leave early on Fridays, with the rest of them having kind of a mix of all in-person or situational. Now, when you look at the green chart on the right, that shows that they thought their state health department, what they thought their state health department's remote work policy was. Half of them reported they worked in a state which they thought was fully remote, and about 1/3 were unsure what their state's policy was. And we tried to center on states that we understood had some kind of remote work policy. So that's why you see such a big green swatch there. In terms of our findings from our qualitative interviews, there were 3 themes that developed that came out of our conversations with these health departments. The first focused on participants' description of the impact of working in a state where the state health department permitted at least some remote work. So one of these themes was around accessibility. The experience of the participants were mixed. Some stating they had more interaction with their state liaison, as found in this first quote, illustrating that it seemed the state staff were a little bit more willing to come meet with us in person. Others had the opposite experience, where it was more difficult to get in touch with their state partner, as illustrated in this other quote. We needed that question answered 2 days ago, and today is too late. The next theme was more broadly, more participants were unclear about what exactly their state health department's policy was. And beyond this, they weren't clear that they should expect when a state staff person was remote, and what to expect in terms of responsiveness or their presence for certain meetings, etc. Finally, one theme was about how participants pointed out that remote work was being available at the state level was being another reason for losing staff from their agencies who went to the state. Most were quick to point out that this wasn't the sole reason their staff may have moved to a state health department job. They also cited things like pay and benefits and flexibility, but they stated that now many staff could get these better paying jobs without moving, and that this was causing a great deal of strain, as demonstrated in this quote here. The second theme, broader theme centered around participants' perspectives on remote policies in their own local health departments. Many cited the positives of remote work options, such as the ability to use it for recruitment and retention, like Polani talked about, ways it offered benefits, such as flexibility to staff, and ways that it offered staff the opportunity to be out more and present in the community. And that's shown in this quote. But also, most had reservations as well for local level remote work policies, citing compatibility issues with local public health work and rural work. They pointed to their role as being in the community and community-based, and that being remote didn't align well with this in a lot of ways. They also highlighted that the nature of the services provided in rural settings necessitated being in person, as this quote illustrates here. We have to report to taxpayers. We're not private entity. Our county board of supervisors are very in tune to what we do. So they're much more visible. Others had concerns about productivity and named issues around lost opportunities for collaboration, as stated here. Finally, conversations with participants highlighted ways that the addition of remote work policies exacerbated existing state and local tensions that are sort of a natural part of public health work. But participants experienced effects of the two systems operating separately. They stated that it would be helpful to have a more coordinated system, as well as an acknowledgement of the strain rural local health departments experience when they lose a hard to recruit staff member to the state. Participants highlighted how valuable it is to have the expertise from the state, with some of them noting that they would like more of this. But at the same time, there was some concern that when this expertise was provided, it may come without an understanding of the local context. So participants shared a desire for more of their local expertise to be used among their state agencies in more of a partnership approach with the state. As I mentioned, we looked at some quantitative analyses with the PHWinds data. Some of it lined up with what we had been hearing in terms of the proportion of those of rural versus urban or state settings working remotely. Here you see that only 7% of local staff reported working remotely most or all of the time, compared to 15% of those in local urban settings, or 52% at the state. These are now national data. Interestingly, only 17% of rural staff who are currently in person would prefer to be working remote. And you can see that this is lower than the other groups. For example, over a quarter of urban staff who are in person would like to be remote, and this jumps to 36% of state staff when you look at these national data. So in a lot of ways, we could see that remote staff or rural staff, would appear to like what they're doing and largely and being in the community. When looking at if a person, quote, plans to stay or leave, we don't see remote policies as a huge driver either way. And only 17% of rural staff reported that remote policies were a reason for staying or leaving. So it is a benefit, but it's more nuanced than that. And this is compared to 27% of urban staff and among state staff, and 54% reporting staying because of remote, with only 25% stating they were planning to leave due to a lack of remote. So rural health departments really do have a different perspective on this. We also looked at differences in remote work related to job tenure and job outcomes, such as things like job satisfaction and ability to balance work for work-life balance, find work-life balance. We found no significant differences really between remote and in-person staff in any of these factors, except with regard to job tenure. And this is interesting that those who had been on their job only 0 to 5 years, they were significantly more likely to be in a remote position than those who'd been in the job over 21 years. So it's more of a earlier career person, earlier career in public health people in those positions. In summary, we found really mixed perspectives from the locals, rural local health department people on their state health department remote policies. At times, there's increased accessibility. Other times, it really interrupted or created barriers to them communicating with their state staff. Participants see the value of remote work, but have limitations on being able to implement it in their own agencies. Recruitment of local staff to state health departments is really found to put a particular strain on rural local public health. And broadly, these perspectives evidence some ongoing tensions between state and local health department relationships, and really provide an opportunity to consider ways to strengthen this relationship and coordination, and really see ourselves as part of a broader system through which we have to work together. So our recommendations, therefore, are to consider remote policies, how remote policies are implemented with respect to accessibility to staff. There was really no suggestion to eliminate remote policies, but rather to be more intentional with how they're implemented and communicated. To ensure clear pathways of communication that they exist between state health departments and local health departments. This is regardless of remote policies, but maybe especially important in this new context. And for those rural health department staff that move to a state position, let's leverage their expertise as a way to grow a state health department's connection to and understanding of rural public health practice in their communities. So that's all I have. I want to thank our study team and my very important co-collaborator on this, Dr. Paula Kett. And I'm going to turn it over to Valerie.
Thanks very much, Betty. Hi, everyone. I'll be presenting on education benefits among governmental public health employees. Next slide. Governmental public health agencies face persistent challenges in recruitment and retention. Prior literature has shown that public health graduates carry a median federal student loan debt of $33,000. At the same time, many governmental public health positions, particularly those requiring a bachelor's degree, offer modest salaries that lag behind private sector alternatives. Next slide. Research across sectors demonstrates that employee-sponsored educational benefits are associated with higher wage gains, longer tenure, and reduced turnover. Employee-sponsored education benefits are often provided as a component of compensation or a type of workforce development strategy. These are distinct from federal programs like the Public Service Loan Forgiveness or the income-driven repayment plans. Common employee-sponsored education benefits include tuition reimbursement, tuition remission, and employer-based student loan repayment assistance. Tuition reimbursement typically requires an employee to pay their educational costs upfront and receive partial or full repayment after successful course completion, whereas tuition remission reduces or eliminates tuition charges at the time of enrollment. And loan repayment benefits, by contrast, provide direct employer contributions towards an employee's existing student loan balance, which provides debt relief rather than support for future education. Next slide. A recent 2023 study that surveyed employees at Fortune 500 companies reported that despite roughly 80% wanting to further their education, only 2% of employees who have access to tuition assistance, a reimbursement, or a remission program actually participated in it. The authors suggest that low utilization was largely driven by employee perceived financial risk, specifically the requirement that employees pay their tuition costs up front and then carry the risk of non-reimbursement should their employment end before they're compensated. Tuition reimbursement may thus have a low uptake among workers who have limited financial flexibility, including those who are early career and those who have lower salaries. Federal loan forgiveness programs, which are often positioned as an alternative or a complementary workforce incentive, face different challenges. Reports from Consumer Financial Protection Bureau document widespread misinformation, administrative errors, and delayed processing within the Public Service Loan Forgiveness Program. There have also been increases in complaints about these programs, and many workers are, quote, off track, unquote, for forgiveness, despite their years of qualifying service. National statistics further show that only a small fraction of public service loan forgiveness applications are approved, raising concerns about the reliability of governmental loan forgiveness as a workforce incentive. Collectively, these findings suggest that there's a disconnect between the availability of educational benefits and their accessibility, their reliability, and their utilization by governmental employees. Next slide. The purpose of this study is to examine how education benefits are structured and implemented across state governmental public health agencies. For our methods, we conducted a structured review of educational benefits available to state government public health employees across all 50 states. Data were collected from publicly available state governmental resources. This included HR and personnel admin websites, employee benefit manuals, tuition reimbursement policies, administrative regulation, university system benefit web pages, health department workforce web pages, and employee application materials. We also we cataloged the type of benefit. So we looked to see if it was a tuition reimbursement, a tuition remission, or a loan repayment program. And in our data collection, we recognized that there was a fourth type of benefit that we were going to catalog, which is a university agreement. And this is where the governmental agent has an agreement with a university that there is a discount to those employees if they enroll in courses through these institutional agreements. And so we cataloged all four of these benefits. Next slide. We also looked at the eligibility criteria. So whether there were limits on how long you had to wait to qualify for one of these education programs, the type or role of the employee and whether or not that was restricted in using this benefit, and whether there were restrictions on part-time employees versus full-time employees. Benefit limits, we looked to see if there were restrictions on the dollar amount that could be utilized by the employee in this benefit, the number of semesters or the length of the program that would be covered, and the types of degree programs covered as well. For this study, we are presenting descriptive statistics and a map of the policies for educational benefits. You'll see on this map that we have cataloged remission and reimbursement, which are the pink and the blue. When there was a remission and reimbursement combined policy, it's presented in purple. And then we cataloged as well university agreements. Those are in yellow. And when there's a combination between reimbursement and a university agreement, that is in green. And so we've got 2 states with just remission, 2 states with reimbursement and remission, that's the purple one, and then 27 states that have a reimbursement educational benefit alone. A university agreement, there are 2 of those. Those are the yellow states, and reimbursement and university agreement has 4 states. Those are the green states. If you'll look at the table on the next page, we present how the benefit limits and the eligibility criteria match up to those policies. And so if it's a remission policy, it's still in that pink category at the top. If it's a black dot, it means that there is a limitation on the dollar amount or the number of semesters of length of program. If it is white, there is not a limitation on the degree program offered. If it is missing a circle, we couldn't find any information on it. So we aren't aware if there is a limit or if it's simply not documented at all. And you can see across this that there are the more common one are limitations on dollar amount. And so if we go to the next slide, I'll summarize that there. So under the eligibility criteria, the benefits that are commonly restricted are those that are permanent or full-time or probation completed employees. And waiting periods for eligibility ranged from approximately 6 months to 36 months of employment, with many states requiring employees to complete their probationary or minimum service period before accessing their benefits. Next slide shows our limitations. So this is the most common limit is on the dollar amount. It ranged from $540 per credit hour to $50,000 in total repayment assistance, although many states capped this benefit between $2,000 and $7,500 annually. There were limitations on length. They ranged from 1 course per semester, approximately 20 credit hours per fiscal year. Programs commonly required coursework or degree programs to relate to the employee's current job duties, to a career advancement plan, or some type of professional licensure or agency workforce need. Now, limitations of our study, we relied on publicly available policy documents, which may not capture specific details of their program that aren't public facing. Policies could have changed since the materials were updated on the various public facing websites that we accessed. And study looked at availability and structure of the programs, but not whether or not employees utilize them or how effective they are. So in sum, education benefits are common, but they vary across state governmental public health agencies. Tuition reimbursement was the dominant model identified across states, and limitations on dollar amount was the most common condition of the benefit. We do have a couple next steps that I want to highlight. We're working on validating the findings with governmental public health agency administrators to determine how these benefits function in practice. For example, in a recent discussion with an employee at the state of Maine, we learned that though they passed a tuition reimbursement policy in their legislature, the state did not provide funding for the program. So while it looks in our data like there is a reimbursement policy in the state of Maine, funding decisions occur at the division, department, or program level. And as a result, employee access to that benefit depends on budget availability rather than guaranteed statewide support for that benefit. We'd also like to use this data set once validated to examine relationships between employee perspectives, how aware they are of these benefits and whether they're using them. Job satisfaction, if this benefit relates to retention or recruitment, and whether or not it relates to any changes in competencies over time. Thank you. Next
So
slide.
thanks to all our presenters. Just to sum up a little bit, I think we heard some very interesting presentations. I do research in this and I learned a lot in these presentations, so thank you to my colleagues. And I think hopefully your key takeaways from this are that it really requires a lot of thinking and operations in terms of how you want to consider the whole employee experience, from application to onboarding to then once they're there, what kinds of policies and work flexibility as well as benefits. So we really can think about this holistically, and in a way gives us a lot of opportunity to engage with our employees and think about their experience in many different aspects. And as we heard, it's nuanced and it really is going to depend a lot on your own agency as well as your state and what the finances and what opportunities there are. But there are also many ways to consider how you can change the working environment with small differences, like we heard about changing some language in the job description, being more communicative. And I think being more communicative was a theme throughout, because what we continually find is oftentimes employees aren't sure about their policies. And when they do have benefits, they might not even be taking advantage of them. So again, sort of thinking more about being transparent and applicant centered when they're first applying, and then thinking about your policies once they're there that support flexibility, engagement, and accountability, and investing in their growth through educational or professional development opportunities. And again, as we said, everybody's agency is a little bit different, and your state and what's going on, you might have different contexts, but I think considering these three aspects can really help you think about how to improve your culture and attract and retain great talent to public health, which we all know is super important. And thank you. And thank you for your time, for listening to us and all of your work and your public service. We appreciate you. Please feel free to check out the CWORPH website. You can also sign up for a newsletter. And of course, feel free to reach out to any of us if you have any specific follow-up questions on any of the work that we presented. Thank you, and have a great day and enjoy the rest of the conference.